one of my key priorities over the next year is to make sure that we have the resources in place to make sure that that fantastic run of public health success in the poorest part of the world through vaccinations is continued. Increasingly, you're seeing philanthropists in Russia. In fact, at the St. Petersburg Forum last year, I chaired a session of Russian philanthropists. Philanthropists from Asia, from China, from Hong Kong, Singapore, and increasingly from Africa, who are stepping up and putting their money and their funds and their expertise at work in solving global problems. And that's a big change. For an organization like us, it's fantastic because it gives us a whole kind of new range of partners that we can talk to. When people say, you know, what's the biggest challenge that you have in eradicating extreme poverty, preventable disease, I always say belief. I always say belief. It's actually convincing people that this can be done. Convincing policymakers that it can be done, convincing decision makers it can be done, and convincing people who support us around the world that this can be done, that we can actually eradicate extreme poverty within 20 or 30 years, and that a whole host of preventable diseases, HIV/AIDS, malaria, TB, and others, can really be tackled, and we can save countless lives. I think critically, there is enormous pressure on us and everyone to be more accountable for what we've achieved, to look for measurable results, to look for metrics, to look for return on investment. I don't think any of us in this field can be fuzzy anymore and just kind of hope that we're doing a bit of good. Those who support us, those who work with us, want to see measurable results, and they want to see kind of clear evidence that their support for us is paying off.